Hello everyone. Today's our guest speaker is Dr. Garima Kedamkar ma'am. She is a specialized neuro rehab and stroke ESD physiotherapist in NHS UK with keen interest in space health and its terrestrial applications. She holds degree in neurology, Masters of Physiotherapy from SVNIRTAR India, Rehabilitation PG Diploma from AIIPMR India, and Space Studies Program, International Space University, France. Ma'am is the first physiotherapist to receive Dr. Kalpana Chawla Scholarship for Space Studies. She was a teaching associate for Southern Hemisphere Space Studies Program 2022 at International Space University. Now, handing over the session to you, ma'am.
Thank you so much for the generous introduction, and I'll quickly share my screen. Please, can you confirm if you can see my screen so that I can start?
Yes, ma'am, it's visible, ma'am.
All right, thank you. Good afternoon, everyone. It's truly an honor to be here. I've been trying to remember what it's like to walk. I'm very sure most of us are familiar with this sentence said by NASA astronaut Sunita Williams and her colleague and NASA astronaut Wilmore, who was also stranded with her, said gravity is really tough, and that's what we feel when we get back. Even lifting a pencil will feel like a workout. So today we are going to step into the unique and challenging world of space physiotherapy, exploring how the absence of gravity shapes human physiology and how we as an healthcare professionals can contribute to optimizing astronaut performance in space. Coming to hazards of human spaceflight, venturing into the space environment, it can have negative effects on human body. So there are total 5 hazards of human spaceflight have identified that drive the risk to human system pertaining to pre, post, and the in-flight challenges. So the first one is space radiation. Outside the Earth's protective magnetosphere, radiation exposure increases the health risk like cancer. The second one is isolation and confinement. So on Earth, we all have the luxury of picking up our cell phones and instantly being connected with nearly everything and everyone around us. But this is not possible in space. However, since the last decade, the communication system has improved so much. The third one is distance from Earth, that is staying away from home. I'm sure most of us, again, staying away from our home for work or for studies can feel this. Fourth one is gravity or lack of gravity, where the astronaut experiences weightlessness and that affects the human body in negative ways, which we'll be seeing shortly. And finally, hostile and close environment. So a spacecraft is not only a home, but it's also a machine where the astronauts are living. Now, all these 5 factors have an effect on human body, but today we are only gonna have a look at the effect of microgravity and how physios are, an integral part of multidisciplinary team to improve, their overall health and the successful mission. The effects of microgravity, when we say, it's basically compared when the astronauts are on Earth and then when they are in space and again when they come back on Earth. So coming to bones and muscles, they form as a result of 2 things. First, the life in the 1G environment of Earth, that is the gravitational environment of Earth. And second, the mechanical forces which are exerted on the body. In space, due to absence of gravity, their formation reduces, but the breakdown continues. Now, this results in overall 2% loss of bone mineral density per month and muscle atrophy that leads to osteoporosis. And that's why astronauts, they are also called as hypersedentary persons. There is decrease in muscle strength, reduced endurance, and increased fatigability. And all this leads to injuries and pain in astronauts. Coming to the cardiovascular system. Now, what happens in microgravity environment is there is cephalic fluid shift. That means gravity is not there to pull the fluid down, and because of its absence, the fluid shifts upwards. This results into puffy face and chicken legs over a period of time. That means the upper body or the face of the astronauts become puffier, whereas the legs really becomes thin. And over a period of time, there will be circulatory blood volume reduction, along with decrease in heart size and reduced aerobic capacity. And astronauts, they experience post-flight orthostatic intolerance upon return to Earth. Coming to the neurosensory system, which comprises of the somatosensory system, the vestibular system, and the visual system. So the somatosensory system, which is, your muscles, your fascia, the tendons, all these sensations, which are giving input to your brain, they are not used much. So as you can see in the video, the astronauts, they are always floating using their upper limbs for moving around. So there is no or little input from the lower limbs, resulting into degradation of the proprioceptive function. And this results into inaccurate external spatial map. Because of the fluid shift, which we've just seen in the cardiovascular system, it results into visual impairment because of optic disc edema and the globe flattening. And coming to the vestibular system, so on Earth, the otolith signals, which can be interpreted as, either a tilt or a linear motion or a translation, because with respect, to the gravity. Now, this stimulation from gravity is absent in weightlessness. So the interpretation of the otolith signal as tilt is inappropriate. Therefore, it is possible that during adaptation, to weightlessness, the central nervous system reinterprets all the otolith signals, indicating as a translation. There are evidences that indicates that the spaceflight environment induces adverse effects on brain, including the intracranial fluid shift, changes in gray matter and white matter. The spaceflight environment also induces the adaptive neural effects such as sensory reweighing and neural compensation. So all these adaptations in neurosensory system results into space motion sickness, which is similar to motion sickness on Earth, space flight associated neuroocular syndrome, altered postural control, altered balance, gait instabilities, problems in eye-hand coordination when they are back on Earth. So overall, if we see all these systems of our body, they decline over a period of time. But the profound multi-system changes that takes place in human body, they are seen as it adapts to microgravity. And this adaptation, what we have just seen as, decline in function, it is frequently referred as deconditioning because the changes that occur, they are unfavorable for life in Earth's gravitational environment. So in general, the physiological adaptations to weightlessness, what we have seen, they are not a significant problem as long as the astronauts remains in space. The physiological problems arise when the astronauts returns to Earth's gravity. And I am emphasizing the word physiological adaptation to weightlessness just to make it very clear that it's not pathological, it's physiological adaptation in a new environment. Now, since we say it is deconditioning because the astronauts are coming back or returning back to Earth's gravity, let's see what's the role of physiotherapy is. Now, each space mission is divided into 3 phases: pre-flight, in-flight, and post-flight. And physiotherapists, they work as an integral member of multidisciplinary team. So pre-flight, a detailed examination is completed comprising of body composition, flexibility, muscle strength, including the hand grip strength, power, core muscle endurance, postural stability, cardiovascular capacity. So all this data has been collected, followed by which the data of each astronaut is matched with the standard criteria of the particular space agency, and then the exercise protocol is customized using the FIT principle. So the pre-flight training. The pre-flight training, it begins, with the mission assignment up to the launch. The exercise program consists of mixed of supervised and unsupervised exercise sessions. The supervised sessions consist of typical gym exercises, but with specific focus on development and implementation of individualized International Space Station in-flight exercise protocol. On a regular basis, say at monthly basis, astronauts, they are requested to provide their training data, including the types of exercises performed, the training time, the intensity, can be, heart rate or any subjective measurements which they are taking, and their personal feedback as well. Now, this data, in conjunction with the results from standardized pre-flight tests, they are used by us to individually tailor the International Space Station exercise countermeasure training programs. And this is done for each astronaut prior to the mission starting. Now, this period is also crucial for building trusting relationships between us. This is to maximize the compliance. So as you saw in the video, there are, different types of exercises like stretching exercises, strengthening exercises. They also do the aerobic training by using treadmill or cycle ergometer, hypoxia training, underwater exercises. And there will be, some variations when you talk about a specific space agency. For example, yoga. So yoga is primarily practiced by Indian astronauts or Gaganyatris, and Rakesh Sharma is fondly known as Antariksh Yogi, as he was the first human to practice yoga in space. There are other exercises like anti-gravity treadmill training, the virtual reality training, and the most important part is the training with replicas. Now, the replica training, because on Earth we have complete setup, whereas on board there are only 3 pieces of equipments upon which they train. So as you can see, this device is called as ARED, that is Advanced Resistive Exercise Device. It is, in the NASA section of the International Space Station. It is slightly different than the squat rock in the local gym, but has these, some of these similar functions, like they can do the squats, deadlift, bench press, shoulder press, etc. Now it has 2 canisters that have vacuum in them, so the astronauts pull against that vacuum. Yeah. The goals of pre-flight training would be prepare the astronauts for this space, conduct pre-flight measures to familiarize themselves with the in-flight training program and equipment with correct techniques, and to treat any pre-existing neuromusculoskeletal conditions if at all they persist. So as you can see here, they are being taught how to adjust a particular equipment according, to the given exercise protocol. Now, once this adjustment has been made, what the astronaut has to do is they have to stand on the yellow platform. The black platform on which he is standing is not there on board. So they have to stand on the yellow platform and start doing the exercises according to that day's particular routine which has been provided to them. And remember, this is the only resistance training device which is present on board in NASA's module of International Space Station. All right, moving next to the in-flight exercise countermeasures. Now, once the pre-flight phase is done, they have conducted all their trainings and medical certifications, and they are clear to fly. Once they reach the space, the in-flight phase begins. The goals for in-flight exercise countermeasures are to maintain good health conditions and high work capacity of the crew members, to mitigate the effects of microgravity on different systems, to save the coordination abilities, allowing them to maintain vertical position, to walk or to run in case of emergency once they are back on Earth. So the in-flight phase, it is divided into 3 phases. Phase 1 is the adaptation phase. So we give them around 20 days, of the mission to familiarize themselves with again, how to use those exercise hardware in an actual microgravity environment, and also to adapt their body, to the new environment. The phase 2 is the main phase where the exercises are performed to prevent the microgravity effects. And phase 3 is preparation for re-entry. That is final 15 to 30 days where the crew member prepare themselves for rigorous re-entry, potential off-nominal landing scenarios, or any other experiments which they have to be doing, or any other measurements which they are likely to be undergoing immediately after returning to Earth or when they are in the process of returning back. So on board on NASA's module, like I said, we only have 3 equipments for exercises. So the first one here, what you can see is the exercise bike, which is called as CVIS, that is cycle ergometer, vibration, isolation, and stabilization. The CVIS protocol, these are based on pre-flight maximum VO2, oxygen consumption, that is VO2 max. And different protocols are being used. So for example, if a Canadian astronaut is using steady state protocols, they are performed at approximately 80% of the pre-flight VO2 max. The second one is the Colbert, that is combined operational load-bearing external resistance treadmill. The treadmill is used in both motorized and non-motorized modes, and it provides a motorized speed up to 20.4 kilometer per hour. Again, the treadmill protocol's intensity is increased throughout the mission by modifying the running speed and the interval duration. Now, both these equipments, the CVIS and the Colbert, I said vibration isolation and stabilization, it is very important. Why? Because the machines are the setup is done in one module, that is like one room of the ISS, and in the adjacent modules there are experiments which are running. Now it is the evidence says that the vibrations which are created due to the exercises can hamper or can have an effect on the outcomes of the experiments which are going on in the other modules, and that's why these equipments are being incorporated with vibration isolation and stabilization system. The last one here is the ARED, which we have seen in the pre-flight phase. Now, the ARED, or the Advanced Resistive Exercise Device, it provides load from 2.2 to 272 kilograms. And the resistance exercise, it is, again, 2 phases. First, to allow the crew member to adjust to microgravity environment and determine the appropriate loads for resistance training. And phase 2 will be full-fledged exercises to be done to mitigate the effects of microgravity. Now, as the muscles and bones of lower limbs, they are more sensitive to microgravity adaptation. The main resistive exercise, they are prescribed, focusing on lower body like squats, heel raises, deadlifts. Yeah, and with minor variations during every session. But we also ensure that an astronaut is receiving comprehensive whole body workout with range of other resistive exercises added, like bench press, which can be again included and varied from session to session. Now, once this phase is over and the astronauts are back on Earth, that's where we called as the post-flight phase. Now, here the goals would be preventing the long-term and short-term painful conditions from developing, like low back pain, addressing any mission-induced physical health problems, returning the astronauts to their pre-flight condition without risking the development of pain or injuries which are associated with readaptation and resumption of loading, and preventing any long-term, conditions from the effects of space flight on them. Now, the um, post-flight reconditioning, again, it is divided into 3 phases. First 2 days back to gravity, up then third to 10-day back to function, and from day 11 to 45 back to work. Now, different test batteries have been developed because it's very important when the astronauts returns back, we assess them first, and based on that, reconditioning program has been developed. So here in the video, what you can see is a part of functional task test, which is an interdisciplinary testing regime. This has been developed to evaluate the astronauts' post-flight functional performance and then the related physiological changes. Each astronaut undergoes, according to NASA's post-flight reconditioning program, 45 days of rehabilitation, where the specific attention will be given to each astronaut's overall condition, the testing results, the medical status, the assigned duties after their mission. So there will be a daily 2-hour session. The first hour is dedicated to physiotherapy, addressing any specific conditions if they are suffering from. For example, astronauts who have done EVA, that is the spacewalk or extravehicular activities, they are more prone to get shoulder injury. So if they at all are having it, we have to give, specific focus on that particular condition. The first week, the exercises, they are performed in a swimming pool in coordination with gym sessions. Why in swimming pool? Because the feeling of neutral buoyancy in water is perceived as comfortable by astronauts and reminding them of the absence of body weight and microgravity. As the crew member progresses, gym time versus the pool time increases, and the exercises then are more performed in the gym. In the main phase of the reconditioning, more times, like I said, is given to do the exercises in the gym, where initially we'll focus on ambulation, cardiovascular endurance, strength, balance, flexibility, and proprioception. And the second phase, it will concentrate more on the active conditioning regimes by adding high intensity aerobic exercises, strength training, introducing power type exercises like jumping, medicine ball exercises, and concurrently more complex movements for balance, agility, coordination, they are being added. So if I have to break it, according to the intensity level or how it goes up to the 45 days. So between R1 or the day one, when they have returned, up to 21 days, the intensity level is increased progressively without evoking any strong physical fatigue effects. And after 21 days of the reconditioning, up to 45 days, the individual training program, which is similar to the pre-flight exercise routine, is been incorporated. The post-flight conditioning, it continues until the crew member regains pre-flight fitness level. So 45 days is a standardized protocol, but if needed, it can extend beyond 45 days. And then what happens is, in the third phase, the astronauts, they are released from formal post-flight reconditioning program, but we encourage them to participate in a maintenance program. So let's see, we have seen the physiology where we've seen the decline, which is again, I would emphasize, it's the physiological adaptation to microgravity. Once the astronauts are back, we are giving them again the reconditioning program. So since I am a physio, I'm an advocate of, exercises to say either it's on Earth or in space, they are the best way to, keep ourselves healthy. Now, to conclude this session, I would like you to listen to what this astronaut say.
Sorry, ma'am, but I cannot hear the sound of the video.
Oh, okay. Do you want me to stop sharing and replaying it then?
Yeah, ma'am, sure.
Yeah, yeah. Okay, I'll do that. So sorry about it. Sound. Mm. Can you see this slide? Yeah.
No, ma'am. Can you play it?
Yeah, yeah, I'm gonna play it.
Yeah, ma'am. Now I can.
One thing to remember is you want to enter your space flight in as best shape as possible. It's hard to make up for a lack of exercise while you're in space, but it is much easier to be able to maintain where you
Oh, does it stop?
are and maybe get a little better if you enter the flight, if you launch in pretty good physical condition. For now, the best way to stay healthy in a zero gravity environment is to exercise.
Yes, so even astronauts believe the best way to stay healthy in an microgravity environment is through exercises. So thank you so much, everyone, for providing me an opportunity to, just introduce this topic and how important it's to be healthy and how important the role of physiotherapy is there, not only to keep them healthy, but also for successful space mission. Thank you so much once again.
Yes, indeed, it was a very knowledgeable session, ma'am. Ma'am, I have one question.
Of course, yeah.
So, ma'am, what is the or what can be the unique challenges we face as a space physiotherapist?
The individual conditions. So, like I said, we know that, some astronauts, depending upon their space mission, will be doing some or the other activities. Okay, so we know, like I said, if an astronaut is going for an EVA or spacewalk, so upper limb or the shoulder injuries are more common. So what we have to do there is the in-flight protocol has to be modified to minimize or to prevent those injuries, but in case still if they have it, so that makes
Hmm.
the reconditioning, I won't say difficult, but prolonged. So, like I said, if the astronaut belongs to NASA and they said standardized 45 days of, program, but if they have sustained something else and there are been, incidences where the injuries are more severe, where we need,
Yes.
more than physiotherapy. So
Hmm.
maybe a surgical repair. So if that is there, that is adding those complications. So I believe, the assessment, first thing is, the in what mission they have been assigned. It's very crucial for us to know which experiments they would be doing or what they would be doing in their space mission. And once they are back, the assessment has to be, very accurate to identify, what all different conditions or what all different injuries if they have sustained.
Thank you so much, ma'am.
Thank you.
Uh, yes, and finally concluding the session, I would like to thank our chairperson, Miss Manisha Sangvi, ma'am, Dr. Parag sir, our respected principal, Dr. Apurva Shimpi sir, our technical team, and last but not the least, our viewers. Thank you so much.
Thank you so much.